We are here at the 2025 Diabetes Summit because diabetes has reached crisis proportions in the country. At the moment, based on Statistics South Africa, diabetes is the #1 cause of death, and it's really creating a lot of havoc in our community. Besides the death, there's a lot of suffering in terms of complications, amputations, kidney failures, and heart failures. So therefore, diabetes has now become the new HIV, if I may call it like that.
So events like this are very crucial because it brings together the whole of society to actually have bold commitment and response, particularly on the emergence of diabetes. And I think for us, one of the things we want to get out of the conference is to declare diabetes a public health threat and an emergency that needs actually bold plans to respond urgently.
We need to engage intentionally and consistently. That means going into communities, listening deeply, and creating safe spaces for people to share their stories. But that's not enough to listen. We also need to translate those stories into evidence, data, that can influence decisions. When patient experiences are combined with data, it's much harder for policymakers to ignore the gaps in service delivery.
A summit like this is really important to me because it's an opportunity for people living with diabetes, so the lived experience component and the clinical expertise. So you're getting doctors and people living with the condition coming together, and it's very rare that those circumstances actually are created in this space. And we get the opportunity not to only learn from the lived experience but from the clinical experience as well. And I think that's a key factor missing in the public healthcare system.
My view on the health promotion levy is that the government should listen to people that are experiencing issues with too easy access to sugary goods. The impact of refined sugar is immense, not only on the rest of my day as someone living with diabetes, but also for the rest of my life. I think as a society we should pay attention to our healthcare and be empowered to do that, supported by our government.
An event like this one matters to me because it creates awareness. A lot of people don't know about diabetes, so it gives us information, we share information, we meet with all the other guys who are also diabetic, and then we connect.
My message to government is that definitely the levy must be increased to 20%. It takes all of us to be in this together and to work together towards reducing the statistics, if not eradicating that completely from our communities and from our society. So yes, we do need government, we do need everyone who's a stakeholder and everyone who is in a position to affect change to work and do the right thing here.